Hi everyone. Today we are going to see board style questions on bacteria, that are the clinical questions on bacteria and the specific subgroup gram-positive cocci. Let's begin. Let's see what is the question number 1. A 27-year-old female present to the emergency department due to the 5-hour history of fever, rash and altered mental status. Her blood pressure is 76/58 and she is tachycardic. She is examined thoroughly and a used tampon is removed from the vagina. A gram stain of the nasal swab specimen reveals gram-positive cocci in clusters. The organism most likely responsible for the patient's presentation produced the systemic syndrome through which of the following mechanism? And here are your options. Pause the video here if you want to try the question. Let's see the answer. First of all, we will anatomically dissect the question. A 27-year-old female present to the emergency department due to the 5-hour history of fever, rash and altered mental status. These three things are very important. Then, her blood pressure is 76/58. That is, she is hypotensive and compensatorily her heart is working more, so she is tachycardic. She is examined thoroughly and a used tampon. Now, this tampon is a clinical giveaway, we will see later, is removed from the vagina. A gram stain of the nasal swab reveals gram-positive bacteria in gram-positive cocci in clusters. Now, gram-positive cocci in clusters gives staphylococcus and the tampon is Staphylococcus aureus. So, the tampon and the nasal packaging are associated with the Staphylococcus aureus infection that they cause toxic shock syndrome. So, the question is basically of a toxic shock syndrome. Now, the toxic shock syndrome here, we have to find what is the mechanism of toxic shock syndrome. So, let's see. First of all, in Staphylococcus aureus, the toxic shock syndrome is caused by the TSTT, that is toxic shock syndrome toxin 1, which is a superantigen. Now, what is a superantigen? A superantigen is an antigen that can directly bind to the T cell and can release massive amounts of cytokines. And these massive cytokines then lead to the exaggerated response, that is the toxic shock syndrome. Now, here you can see this is the page that has been taken from the 1st date 2019. Now, it is associated with prolonged use of vaginal tampons and nasal packaging. Now, toxic shock syndrome is also caused by Streptococcus pyogenes, but this is not toxic shock syndrome of Streptococcus pyogenes because it will always be associated with painful skin infection, and we have no history of painful skin infection here. So, the correct answer would be option D, that is excessive release of cytokines. Moving on to the question number 2. A 4-year-old boy is brought to the office due to skin lesions on his face for the past 2 days. His temperature is 36.1 degrees Celsius or 97 degrees Fahrenheit. The patient is uncomfortable but non-toxic appearing. On dermatological examination on his face, there are tender perioral papules and pustules, some of which appear to have broken down and are covered with a golden yellow crust. Exudate microscopy reveals a gram-positive cocci in chains. Which of the following is the component of the clinical syndrome most likely to follow such an infection? And here are your options. Pause the video here if you want to try the question. Let's see what is the answer. So first, anatomically dissecting the question, we will find a 4-year-old boy is brought to the office due to skin lesion on his face for the past 2 days. His temperature is this and his uncomfortable non-toxic appearing. This is very general and this is for all the patients you will find this. On dermatological examination of his face, there are tender perioral papules and pustules which appear to have broken to give golden yellow crust. Now this is basically honey crust appearance. And this honey crust appearance gave impetigo. And impetigo, and here to support the answer more, they have actually also given their gram-positive cocci in clusters. So gram-positive cocci, in chains. So that is the Streptococcus. And this impetigo is being caused by the Streptococcus pyogenes. Now, here is the tricky part. Which of the following component of the clinical syndrome most likely to follow such an infection? Now, you will see that you can find that it is impetigo. The most important point is the strain that are causing impetigo leads to glomerulonephritis. Why? There are different strains that can cause acute rheumatic fever and they will lead to heart defects. So when we will see the options, you will see that the answer would be glomerulonephritis. In glomerulonephritis, there will be blood coming in the urine, so that will produce the dark urine, and then there will be edema, so there will be facial puffiness. So this will be the correct answer. But if you will see the option D, if the history was similar but it was given there, it instead of acute except the impetigo, there was acute rheumatic fever, then the option D would have been the right answer, because then it would have caused fatigue and heart murmurs. So you have to remember that in Streptococcus pyogenes infection, if the history of acute rheumatic fever, it will always lead to heart murmur, and if it is of impetigo, it will always lead to glomerulonephritis. These both are mutually exclusive disease. They both can't occur simultaneously. Let's move to the third question. Now, after an automobile accident, a 23-year-old woman requires an emergency splenectomy. Her subsequent recovery is uneventful. However, 4 weeks after the surgery, she is brought to the emergency department unconscious and non-responsive. The emergency department physicians are unable to stabilize her, and she expires 1 hour after she arrived. Blood is collected for the culture, chemistry tests are being conducted, and hematology tests are being done. The technologist examination of the peripheral blood smear observes abundant bacteria. Within 6 hours of the blood culture is also reported to be positive for the gram-positive cocci. So here is the figure that has been attached to this. Now, which organism is most likely responsible for the overwhelming infection? Pause the video here if you want to try it on your own, and let's see what is the answer. So anatomically dissecting the question first. Now the important point here is splenectomy. Now the person who have undergone splenectomy are more susceptible to the infection by encapsulated bacteria or encapsulated organism. Now instead of splenectomy, the history could also have given patient suffer from sickle cell anemia, because sickle cell anemia patient are functionally asplenic. So in questions, if you find sickle cell anemia, you will always relate it to the splenectomy, that it is the patient does not have spleen. So this patient are also susceptible to the encapsulated organism. So the technologist examining the peripheral blood smear observed abundant bacteria and the positive gram-positive cocci. And the gram-positive cocci, so we will here, these are the cocci and these are arranged in chains. You can see now these are in chains. So this is Streptococcus. So the answer is Streptococcus pneumoniae. Now Streptococcus pneumoniae is basically an encapsulated bacteria, and here it is again taken from the first in 2019, that is, it is asplenic patient and no virulence without capsule. So if the capsule was not there, there would have been any virulence. So you can find it in the sickle cell anemia disease or asplenic patient. So this is quite memorizing question. After that, let's move to the question number 4. This is the explanation. If you want to read, you can pause the video here and read the whole explanation why asplenic patients are more, because they have basically producing opsonizing antibodies, and if the spleen is being removed, now this can't be produced, and this can't be produced, then encapsulated organism infections such as Streptococcus pneumoniae and Haemophilus influenza. If the image was not attached, then there would have been two answers, like it could be Streptococcus pneumoniae or H influenza, but it has been said that it is gram-positive cocci. That's why it was the Streptococcus pneumoniae. Okay, now moving to the question number 4. A 43-year-old woman sees her family physician with complaints of dull, persistent pain surrounding her nose and a feeling of paranasal fullness. These symptoms develop after a viral respiratory infection that she had 3 weeks prior to the visit. A CT scan of the head shows opacity in the paranasal sinuses. This is the CT scan attached, and confirms that the clinical diagnosis of chronic sinusitis. So here the diagnosis has already been given, chronic sinusitis, else you could have figured out on your own as well, because dull, persistent pain surrounding her nose and her feeling of paranasal fullness, this all lead to the diagnosis of sinusitis. Which organism is most likely responsible for this infection? Now pause the video here if you want to do the question on your own. Let's see what is the answer. Okay, so here the dull, persistent pain surrounding her nose and paranasal fullness leads to chronic sinusitis, and opacity of the paranasal sinuses all reveal the sinusitis. Now important thing is, it is after a viral respiratory infection. Now this is basically a question of sinusitis after viral infection, and the most likable cause for this is Streptococcus pneumoniae. Thus the answer will be Streptococcus pneumoniae, and it is the bacteria that will cause the sinusitis after viral infection. So it is always the typical history of 2 to 4 weeks after the viral infection the patient got sinusitis, and the answer will always be Streptococcus pneumoniae, because it is the most likely cause. Now moving to the last question for the day, that is, a 27-year-old female present to the physician for a follow-up visit at 37 weeks gestation. The physician recommends vaginal and rectal cultures to screen for the colonization of potentially harmful microorganisms transmitted to the neonate during childbirth. The organism of interest most likely demonstrate what type of hemolysis. So here the option will be alpha hemolysis, beta hemolysis, gamma hemolysis, none of the above, or like that. So pause the video here if you want to try it on your own. Let's see what is the answer. Now here 3 things are very important, that is a 37-week gestation. Now it is normally occurring in beta hemolysis. This is basically the question for Streptococcus agalacti. Now Streptococcus agalacti normally occurs between, now the history you will find 35 to 37 week gestation period, and it is recommend vaginal and rectal cultures. Now Streptococcus agalacti is being found in the vaginal and rectal cultures, and the giveaway was 35 to 37 week gestation. Now it is basically beta hemolytic and it is found in the babies. Group B, it is just a mnemonic to remember. It is a Streptococcus agalacti belong to the group B according to the classification, and it is for the babies, and it is also beta hemolytic. So 37-week gestation recommend vaginal and rectal cultures and transmitted to the neonate during childbirth. So this is very important, the Streptococcus agalacti. Now this is not important for this question particularly, but yeah, there can be a separate question where it can be told they transmitted to the neonate during childbirth. So Streptococcus agalacti is transmitted to the neonate not intrauterine but during the childbirth, and it produces beta hemolysis. This brings to the end to this lecture, this small questions clinical. Stay tuned for more such questions, and thank you for watching till the end. Thank you.